Inspection. Inspect the skin for color, lesions, trauma, or abnormalities. Inspect the head, skull, hair, and scalp. Inspect the eyes, then inspect the ears.
Mag-flashlight na sa mga
Wala raman.
Inspect the nose, and then inspect the mouth, then the throat or neck. Then inspect the chest and lungs and heart. Next, palpate the skin. And then palpate the head. Palpate the ears, the nose, the neck, the chest and lungs, and the abdomen. And then percussion of the chest and lungs. And percussion of the abdomen. Then auscultation of the chest and lungs. Auscultate the heart. And auscultate the abdomen.
Wala na.